This is my presentation about natural and artificial method of contraception. I will describe the method and how it is being used. I am Angela T. Torrenueva, Bsed-Math 1. Methods of contraception. Artificial method. Artificial methods in common use include preventing the sperm from reaching the ovum, using condoms, diaphragm, and etc. Inhibiting ovulation, using oral contraceptive pills. The example of artificial oral contraceptives, also known as the pill oral contraceptives, contain synthetic estrogen and progesterone. To use the pill, it is recommended that the woman takes the first pill on the first Sunday after the beginning of a menstrual flow, or the woman may choose to start the pill as soon as it is prescribed. The advantage and disadvantage of oral contraceptive. The advantage, it does not interrupt sex. It usually makes your bloods regular, lighter, and less painful. It reduces your risk of cancer of the ovaries, womb, and colon. It can reduce symptoms of premenstrual syndrome. The disadvantages, adverse effects include nausea, breast tenderness, breakthrough bleeding, amenorrhea, and headaches. Oral contraceptives do not provide protection from STDs. Daily administration is necessary, and inconsistent use may increase the failure rate. The side effect of oral contraceptive. Side effects of OCO are nausea, weight gain, headache, tenderness, breakthrough, bleeding, vaginal infections, mild hypertension, and depression. Transdermal fudge. The transdermal fudge has a combination of both estrogen and progesterone in a form of a patch. Remove the patch from each pouch and peel off half of its protective liner. Place the adhesive side of the skin. Then peel off the other half of the liner. Place the skin patch firmly with the palm of your hand for at least 30 seconds, making sure it adheres the skin, especially at the edges. The disadvantage and advantage of transdermal fudge. Transdermal fudge delivery offers several benefits over oral delivery, including smooth, continuous drug delivery, increased bioavailability, and reduced drug interactions. Patches can be easily applied by the caregiver, and they provide a visual cue that the medication has been administered. The disadvantage of the transdermal patch. The main disadvantage of transdermal delivery systems stems from the fact that the skin is a very effective barrier. As a result, when the medications whose molecules are small enough to penetrate the skin can be delivered by this method. The side effect of transdermal patch. Bloating or swelling of the face, arms, hands, lower legs or feet, swelling born or blister at the patch site, tingling of the hands or feet, unusual weight loss. Wearing the patch. The contraceptive patch can be worn on 4 places of your body: abdomen, upper outer part, upper torso, and buttocks. Vaginal ring. The vaginal ring releases a combination of estrogen and progesterone and surrounds the cervix. This silicone ring is inserted vaginally and remains there for 3 weeks, then removed on the 4th week as menstrual flow will occur. The advantage and disadvantage. The advantage, it used correctly. The vaginal ring is more than 99% effective. One ring provides contraception for a month, so you don't have to think about it every day. You can continue to have sex with the ring ease and fleece. Unlike the feel, the ring still works if you have sickness or diarrhea. The side effect, it may cause temporary side effects such as increased vaginal discharge, headaches, nausea, breast tenderness, and mood changes. The ring doesn't protect against STDI. The uterus, vaginal ring, subdermal implants. The subdermal implants are two rod-like implants embedded under the skin of the woman during her menses or on the seventh day of her menstruation to make sure that she is not pregnant. Inserted beneath the skin of the upper arm, the implant releases a progestogenal hormone to prevent sperm from reaching the egg. The disadvantage and disadvantage. The advantage, works for 3 years. It doesn't interrupt sex with an option if you can't use estrogen based contraception, such as combined contraceptive pill, contraceptive patch, or vaginal ring. It's safe to use while you're breastfeeding. Disadvantage of the contraceptive implant include it offers no protection against sexually transmitted infections. The side effect, amenorrhea, light or irregular bleeding, frequent bleeding episodes more than 5 in 90 days, continuous bleeding for weeks more than 14 days, occasionally menorrhea. Subdermal implant. Implant is placed underneath skin of arm. Hormonal injections. A hormonal injection consists of medroxyprogesterone, a progesterone, and given once every 12 weeks intramuscularly. It is given as an intramuscular injection in the buttock or the upper arm and over the next 12 weeks. The MPDA is slowly released into the bloodstream to prevent pregnancy. An injection must be given every 12 weeks. The advantage and disadvantage. The advantage, it may reduce heavy, painful periods and help with premenstrual symptoms for some women. Disadvantages, your periods may change and become irregular, heavier, shorter, lighter, or stop altogether. This can carry on for some months after you stop the injections. The side effect, you may experience side effects like headaches, acne, hair loss, decreases sex drive, and mood swings. Intra-urine device. The intra-urine device is a small, T-shaped object that is inserted into the uterus via the vagina. It prevents fertilization by creating a local sterile inflammatory condition to prevent implantation. To put the intrauterine device in, the nurse or doctor will put a speculum in your vagina and then use a special inserter to put the intrauterine device into the opening of your cervix and into your uterus. The process usually takes less than 5 minutes. The advantage and disadvantage. It protects against pregnancy for 5 or 10 years, depending on the type. Disadvantage. It has minor and major drawbacks, such as menorrhea is a frequent complaint, as are dysmenorrhea and polymenorrhea. The side effects, such as acne, headaches, or breast tenderness. Chemical barriers. Chemical barriers such as spermicides, vaginal gels and creams, and glycerin films are also used to cause the death of sperms before they can enter the cervix, and also lower the level of the vagina so it will not become conducive for the sperm. Spermicides are sperm-killing chemicals inserted deep into the vagina near the cervix before sex. The disadvantage and advantage. The advantage, easily available and affordable condoms can prevent the spread of STDs when used properly. Disadvantages. Effectiveness as a contraceptive is compromised when the condom is damaged or not used properly. Using a male condom requires a pause just before the sex act, resulting in people foregoing using it at all. Side effect. Skin damage. Diaphragm. The diaphragm is a small, dome-shaped device made of silicone or latex that fits inside the vagina and covers the cervix. It must be used with spermicide. There are two types of diaphragms. Both diaphragms are available by prescription only. Apply spermicidal gel around the rim and inside the dome of the diaphragm. The side that will face or be in count, squeeze the rim or sides of the diaphragm between your fingers. The disadvantage and advantage of diaphragms. It has no effect on your natural hormones. It does not affect milk supply if you are breastfeeding. The disadvantage. Use of a diaphragm and spermicide may cause vaginal burning and irritation from the spermicide. Some people are allergic to spermicide or latex and may have a reaction. The side effect. Use of a diaphragm and spermicide may increase the risk of urinary tract infection or UTI. Cervical cup. The cervical cup is a small plastic dome that fits tightly over the cervix and stays in place by suction. It acts as a barrier to keep sperm from entering the uterus. It should be used with a spermicide. A healthcare professional must fit and prescribe the cup. The type available in the United States comes in 3 sizes. Apply spermicidal gel inside the groove between the rim and the dome of the cup. In the valve of the cup and on the outer dome of the cup, squeeze the cup between your fingers with the inside of the ball facing up. Insert the cup in the vagina with the long brain entering first. Press the cup onto your cervix until it is completely covered. The advantage and disadvantage. The advantage. It has no effect on your natural hormones. It does not affect milk supply if you are breastfeeding. It can be inserted up to 40 hours before sex. Disadvantage. The spermicide used without cervical cup can increase the risk of getting HIV from an infected partner. You should use the cervical cup only if you can one sexual partner and both of you are at low risk of HIV infection. Side effect. Use the cup may cause vaginal irritation or color or odor. Contraceptive jelly. Cervical cup, uterus, cervix, cervical cup, vagina. Male condoms. The male condom is a latex or synthetic rubber shell sheath that is placed on a erect penis before vaginal penetration to trap the sperm during ejaculation. Unroll condom all the way down the penis after sex, but before falling out, hold the condom at the base, then pull out while holding the condom in place. Carefully remove the condom and throw it in the trash. Advantage and disadvantage. The advantage: proper and consistent use of condoms prevents transmission of sexually transmitted devices. Condoms are easy to use and very little practice is needed. Excessive friction during intercourse may cause the condom to tear them and may result in an unwanted pregnancy. This can be avoided by waiting a while before covering the penis with a condom during sexual intercourse. However, this need for interruption of the act can be a mood killer. The side effect of condoms. It may lead to rash, hives, and a runny nose. In several cases, it can even tighten the airways and decrease blood pressure. If you or your partner is allergic to latex, then you must put for a polyurethane or lambskin condom. Female condom. These are also latex rubber sheets that are specially designed for females and pre-lubricated with spermicide. It has an inner ring that covers the cervix and an outer, open ring that is placed against the vaginal opening. While holding outside of condom, at close end, squeeze sides or inner ring together with your thumb and forefinger and insert into vagina. The advantage and disadvantage. The advantage: female condoms help to protect both partners, including HIV, when used correctly. They are a reliable method of preventing pregnancy. Disadvantage: female condoms are very strong, but they may split or tear if not used properly. They're not as widely available as male condoms and can be more expensive. The side effect: rarely latex rubber condoms can cause irritation for people with latex allergies or sensitivities, and sometimes the love on certain types of condoms may be irritating. Surgical methods. One of the most effective birth control methods is the surgical method. The two kinds of surgical methods are used by either the male or the female and will ensure that conception is inhibited after the surgery for as long as the client lives. Vasectomy. Males undergo vasectomy, which is executed through a small incision made on each side of the scrotum. The vas deferens is then tied, cauterized, cut, or flagged to block the passage of the sperm. Vas deferens fold through incision and cut. Tubal ligation. In women, tubal ligation is performed by offloading the fallopian tubes from cutting, cauterizing, or blocking to inhibit the passage of both the sperm and the ova. Natural method. Abstinence. This natural method involves abstaining from sexual intercourse and its most effectively natural birth control method with ideally 0% fail rate. For most people, abstinence means not having sex with anyone. Advantage: better health. You probably have fewer physical and emotional concerns. Certainty: If the relationship lasts without sex, there is a good chance it will be a strong relationship. Confidence. You know that the other person likes you for you and not just for sexual attraction. Calendar method, also called as a rhythm method. This natural method of family planning involves refraining from coitus during the days that a woman is fertile. The calendar rhyme method. These days may be unsafe if 28 days cycle varies as much as 8 to 9 days between shortest and longest cycles. Intercourse on these days will leave live sperm to fertilize egg. Egg may still be present. Ovulation. Basal body temperature. The woman must take her temperature early every morning before any activity, and if she notices that there is a slight decrease and then an increase in her temperature, this is a sign and she has ovulated. The advantage. Basal body temperature can be used as a way to predict fertility or as a part of a method of contraception by helping you gauge the base days to have or avoid unprotected sex. Cervical mucus method. The basis of this method is the changes in the cervical mucus during ovulation. To check if the woman is ovulating, the cervical mucus must be copious, thin, and watery. The advantage and disadvantage. The advantage. The cervical mucus method is a way to identify fertile times to help you gauge the visits to have or avoid unprotected sex. Disadvantages. The cervical mucus method does not protect against sexually transmitted disease. Also, several outside factors can change the look and feel of several mucus. Semprothermal method. The semprothermal method is simply a combination of the BBT method and the cervical mucus method. The woman takes her temperature every morning before getting up and also takes note of any changes in her cervical mucus every day. Advantage. The symptothermal method has a significant advantage in effectiveness because it combines the calendar, cervical mucus, and temperature methods. Ovulation detection. The ovulation detection method is an over-the-counter kit that can predict ovulation through the surge of luteinizing hormone that happens 12 to 24 hours before ovulation. The kit requires the urine, specimen, or the woman to detect LH. Advantage and disadvantage. Advantage. Ovulation test kits may be beneficial if you have slightly irregular periods or find other methods of tracking your fertility difficult or unreliable. Ovulation test kits can be expensive and there are no guarantees. Coitus interruptus. This is one of the oldest methods of contraception. The couple still proceeds with the coitus by the man withdraws and the moment ejaculates to imitate the spermatozoa outside of the vagina. Disadvantage. The disadvantage of this method is pre-ejaculation fluid that contains a few spermatozoa that may cause fertilization. Coitus interruptions. Coitus in which the penis is withdrawn from the vagina before ejaculation. That's all. Thank you.